Hello, welcome to week 2 of the medical assistant training, and I'm delighted to share with you the content that we will be covering in week 2 of the medical assistant program. Now, this week, week 2, we will spend 3 days, of course, in class, and we will have subjects such as medical terminology, terminology to cover quite a few anatomy and physiology information, and we will have quite a bit of information this week on disease pathology. And so we will spend 6 hours in class this week, as well as 6 hours of asynchronous learning on anatomy and pathophysiology. And for those, you will be developing concept maps, and I will be sure to share with you the concept maps when you come into school. And that's how we would learn about the various aspects of anatomy and physiology as you come in. Also, this week we will spend about 6 hours of asynchronous learning in disease pathology. So this week we will cover quite a few chapters. We will cover chapter 12, 14, 15, 16. We'll skip 17, come back to 17 a little later. We will do chapter 18, 19, 20, 21, 22, and 23. And yes, these might seem like a whole lot of chapters, but they're short readings, and this week we will get right through them. So in week 2, we will cover, like I said, medical terminology relating to the body systems. And so we will try to understand many of the medical terminologies. We will discuss some common roots and prefixes and suffixes that you would come across in medical terminology. We will identify some of the common abbreviations that you would learn. We would also identify common anatomical terms of locations and directions. And so, for example, you might be able to say that the radial pulse can be found at the base of the thumb. And we would also discuss cells, tissue, organs, and body systems. So that's kind of like the medical terminology that we will review here in chapter 12. In chapter 14, we will talk about the skin and the related care. Therefore, we will identify the role of the skin, the different parts of the skin, the disease processes of the skin, and what we as medical assistants or caregivers can do to facilitate some of the symptoms that we'll come across. We will talk about the various lifespan changes and some of the chronic conditions and acute conditions of the skin. We will also learn to describe and examine the skin, and we would learn about the abnormalities that we can report or identify, and we will discuss some of the education that we can share with the patients on problems relating to the skin. So we'll do this subsequently for all the other systems that we'll come across this week. And when you come into class, we will share with you the concept maps, blank concept maps that you will use as you study these different systems. The musculoskeletal system, we will describe the structure and the various functions of the musculoskeletal system. We will discuss the lifespan changes, like the normal changes or abnormal changes within the musculoskeletal system. We would list the chronic and acute conditions such as fractures or arthritis, pain, and so forth, the common ones. And we will learn to examine and procedures related to identifying problems relating with the musculoskeletal system. We will also discuss patient education as far as some of the musculoskeletal problems that one may have. We would also go on to, in chapter 16, discuss the nervous system and the sense organs and the related care concerning or related to some of the disorders of the nervous system. So we will discuss and describe the structure and functions of the nervous system and the sense organs. The sense organs are part of the nervous system as well. We will discuss the lifespan changes to the nervous system and the sense organs. We will list common chronic and acute conditions of the nervous system and the sense organs. We will describe an examination and procedures related to the nervous system and the sense organs, and we would learn or discuss patient education related to these problems as well as the sense organs. So that's about the nervous system. We'll skip chapter 17 until we start to work with EKG. The respiratory system is another system that we will take a look at. We will describe the structure and the function of the respiratory system. We will describe any lifespan changes and normal changes of the respiratory system. And we would list common chronic diseases and acute conditions related to the respiratory system. We would describe examinations and procedures relating to identifying problems with the respiratory system. And we would discuss education related to problems of the respiratory system. Moving right along, we will look also at the urinary system. This is in chapter 19. And for that, we will discuss the structures and the function of the urinary system. We will describe and discuss the lifespan changes related to the urinary system. We would describe examination and procedures relating to the urinary system, such as like collecting specimens of urine, and we will discuss the education related to the urinary system and how it would impact patient care. Relating to the gastrointestinal system, we will discuss and describe the structure and function of the gastrointestinal system, also known as the digestive system. We would also discuss the lifespan changes to the gastrointestinal system. We will list common chronic and acute conditions relating to the gastrointestinal system. We will describe examinations and procedures in identifying problems relating to the gastrointestinal system. And we would also discuss patient education. Many times the medical assistant has to go back and teach the patient about certain diseases. When the doctor has already said, the medical assistant would still be knowledgeable on the topics to cover with the patient. We would also cover the reproductive system, that's in chapter 22, and we will again describe the structure and function of the reproductive system, the lifespan changes. We will discuss pregnancy, childbirth, and common disorders of pregnancy in that chapter. We would also list chronic and acute conditions relating to the reproductive system, such as STIs and so forth. We will describe examinations and procedures, and we'll tell you all about that as we go through. We would complete our concept maps relating to the reproductive system. We would also learn about procedures and examination procedures relating to the problems of the reproductive system, and we would also discuss patient education relating to this system as well. Finally, in chapter 23, for week 2, we will discuss the immune and the lymphatic system and related care. Therefore, we would identify the structures and the functions of the system. We will discuss lifespan changes relating to the immune and lymphatic system. We will list common and acute conditions relating to the immune and lymphatic system, such as like cancer, HIV. Those are chronic and acute conditions that will affect the lymphatic and immune system. We will examine some of the procedures and examinations necessary to identify problems of this system, and we will discuss patient education as it relates to this system. That's about it for this system systems in week 2. Thank you.